Hi guys, this is Dr. Tonya Echols Cole. I am a board certified radiation oncologist and breast cancer survivor. I am here to help survivors see what's possible for their lives after cancer. I want to help you improve your confidence. I want to help you push past your fears. And we're going to do that today by talking about something that we call Chemobrain. Chemobrain, Chemobrain. Before I actually was diagnosed with cancer, I actually didn't know what Chemobrain was. I would hear patients come in talking about problems that they were having with their memory, problems that they were having, really functioning, and they would call it quote unquote Chemobrain, and I never really knew what that was. It's not something that we really taught in medical school. But after having gone through cancer treatment myself, I realized that Chemobrain was a very, very real phenomena. It showed up as I started to get back into practice, going back to work, dealing with patients, having to have business conversations. I realized that Chemobrain was real. And the way it showed up for me in my practice was that I would talk to patients. I would be in the middle of a consultation with the patient and I would forget my next thought. I would have to pause and gather myself and remember what it was I was talking about. Things that I would commonly refer to, I would have trouble remembering. Sometimes it would even be patients' names. It could be, I would be explaining side effects of a particular treatment, and I would forget what I was talking about. And it's very distressing. It is very embarrassing. It is very unnerving to have that kind of memory loss or memory lapse happen when you're trying to conduct business. So I know that for patients who experience Chemobrain, we really want to find ways to cope with it and ways to deal with it. Now, Chemobrain isn't just memory loss or memory lapse. It can be really more of a cloudiness that you get in your mind, a kind of a mental fuzziness that you get with your thinking. It can show up in different ways. It can show up with trouble concentrating, trouble focusing on different things, not being able to remember details, like names or dates. People are having trouble multitasking. You can't cook. You can't answer the phone at the same time. It's taking you longer to do things than it used to because you're disorganized and you can't gather your thoughts. Those are all symptoms and signs of Chemobrain. Now, we don't know what causes Chemobrain, and it could be really due to a variety of different things. It doesn't have to happen in someone who's had chemotherapy. It can happen in someone who has had no treatment. It can happen before you even start treatment. It can happen as a result of treatment. It can happen as a result of radiation treatments that you get to the brain. It can happen as a result of just severe fatigue related to treatment. It can happen as a result of stress and anxiety or depression related to treatment. It can happen as a result of infection. It can happen as a result of medications that are given to you during your treatment, whether these be things to help with nausea, hormonal treatments, or it can happen as a result of surgery to your brain, or as a result of the anesthesia that's given to you during your surgery. So as you can see, there are many different things that can cause problems with your memory, cognition, and focusing ability that happen during your cancer treatment, either before, during, or after your cancer treatment. So it's really important as a cancer patient that if you're starting to experience any of these symptoms or side effects, that you talk with your healthcare provider about them, because there are definitely things that you can do. There are definitely ways that you can cope with the symptoms of Chemobrain. So in my next video, I'm going to share with you how you can retrain your Chemobrain. I'm going to also share with you how you can reprogram your mind and how to best optimize your brain health so that you keep the healthiest brain that you can while you are going through or recovering after treatment for cancer. Yes, because there are definitely some things that you can do. There are definitely some strategies and things that can help you cope with the signs and symptoms of Chemobrain. So until next time, this is Dr. Tonya Echols Cole, board certified radiation oncologist, breast cancer survivor. I'm here to help show you what is truly possible for your life after cancer. I want to show you how you can be awesome after cancer.